Hi, my name is Nir Patel. I'm validating for IV Piggyback for Professor Hayes' class, section 602. I want to make sure I follow the 7 guidelines prior to starting any procedure. I want to check the physician's orders, wash my hands, gather all my equipment, identify the patient by the wristband with their ID tag, and asking them their full name and date of birth. Also want to introduce myself, explain the procedure to the patient, and provide for privacy. Because it is a medication, we want to make sure we do all the medication rights, which will be identifying, make sure it's the right patient, right time, right date, right dose, right drug, right reason, and make sure we document everything. Prior to setting this up, I also want to make sure that the IV site for the patient is not dislodged or is red or any other type of abnormalities. Now I'm going to take the medication, make sure one more time that it's the correct medication. I'm going to label it, put the label on it, put my date, time, and also my initials on it. I want to make sure we use the correct tubing, check the drip factor on the tubing.
I just say it with my hand.
And we're going to go ahead and lower the main IV bag.
So you turn this off, you pinch, so you keep that pinch. If you don't keep that pinch,
We're going to keep sterile by keeping the end cap above our waist at all times. And we're going to spike the medication.
for validation, we actually going to put our stethoscope.
Let's fill it up halfway. And we got to make sure everything's clamped beforehand. We're going to open up the cap, put it upwards so that it keeps sterile, and then prime the tube.
Just a little. Like when you're showing
There's no bubbles in the tubing now. I'm going to go ahead and recap that. Keeping it sterile, keeping it above the waist. We're going to take the IV port and swab it for 15 seconds or 15 times. Make sure that's clamped, and make sure the IV tubing is clamped at this point as well. And uncap.
My belly button's here, but really there's something too long. Also, one return to swallow.
Go ahead and screw in the piggyback.
When they have
As you're putting it in case they ask you how
oh, okay.
At all times, we want to make sure the bed was above the waist at a working level. Now that this would be hooked up to the patient while setting up the drip rate, the drop rate, and then the doctor's order said 16 per minute, so we're going to do 4 drops for 15 seconds. And we're going to set the drop rate with the main IV tube. So we're going to go ahead and open up the clamp on the piggyback.
I would have probably
If it's open within 20 seconds, label out. Okay. So how much do you pour in there?
Yes, so I'll start with one. You gotta remember, slowly, very slowly flush it. Bring it under the heart.
Gravity. No, so we decided it's in the right place. Because we heard the whoosh. We put 20 or 30 milliliters of saline in, and then we just pull out. Think about that during validation.
No, so text.
Are we actually gonna and that's it, right?
Get the right.
Everyone says it's easier, but
I would check for grade date and
first thing you're gonna do is turn off the machine. That's gonna be
This mission.
you can hear it, but don't slow it. So you're gonna depend on the quality. You turn it off. You're gonna wait 30 minutes before you do anything.
What's the purpose of that? Just so that the
Give
remaining.
them time to digest. So you can see whatever's in there is digesting. You know what your growth rate or you calculate how much should be going in. So now you can estimate how much is coming out. So you better rate if it's half, is it done? If it's more than half is still left in there, it's like an hour, then not digesting correctly. There's also 100 mils, less than 100 mils is fine, over 100 mils, depending on the situation. Well, like the thing is, 300 mils of food, and you get 130, then you're fine. But the general rule of thumb is that is a factor is if it's under 100 mils, that you pull out, you can put it back in, if it's over 100 mils.
It's just a label.
Leave it out. So
But we don't do the labels. Labels are.
So if you
it
put
depends on
in,
how you measure it.
yeah, if let's say you put in 300 and you pull out 200, that's the problem.
Right. That's what it's doing.
Again, I think it depends on the situation, the doctor, the order, you know, whatever they're not, if they're gonna want to have a half roll, or if they want to load up.
So the kangaroo bag.
Once we're done with that, we want to make sure that we know what time to come back on, so we can correctly
The gravity. And then they're gonna have
set the drip rate for the IV bag again and raise it up. Once everything's done, I want to lower the bed all the way down for client safety. Make sure that they have a call bell accessible. Clean up. Make sure I wash my hands and make sure I do all my notes and documentation. Thank you.